Breastfeeding is a natural and universal practice that has been around for centuries. However, the way it is perceived and practiced varies greatly across different cultures around the world. In some cultures, breastfeeding is seen as a sacred and essential part of motherhood, while in others, it is considered taboo or even frowned upon. In many traditional cultures, breastfeeding is not only the primary source of nutrition for infants, but it is also seen as a way to bond with the baby and provide comfort and security. In some cultures, breastfeeding is even believed to have spiritual significance, with some communities performing rituals or ceremonies to celebrate the act of breastfeeding. In countries like India and China, breastfeeding is not only encouraged, but it is also seen as a sign of good health and prosperity. In these cultures, mothers are often encouraged to breastfeed their babies for an extended period of time, sometimes up to 2 years or more. Breastfeeding in public is also widely accepted in these countries, with mothers often feeding their babies openly without fear of judgment or criticism. On the other hand, in Western cultures like the United States and Europe, breastfeeding has not always been as widely accepted or encouraged. In the past, there was a stigma attached to breastfeeding in public, with many mothers feeling pressured to cover up or feed their babies in private. However, in recent years, there has been a shift towards normalizing breastfeeding in public, with many celebrities and public figures advocating for the right of mothers to breastfeed wherever and whenever they need to. In some cultures, breastfeeding is seen as a way to pass down cultural traditions and values from one generation to the next. In countries like Nigeria and Kenya, breastfeeding is not only a way to nourish the baby, but it is also seen as a way to connect the baby to their cultural heritage. Mothers in these cultures often pass down stories and songs to their babies while breastfeeding, creating a strong bond between mother and child. In other cultures, breastfeeding is seen as a practical necessity due to limited access to clean water or formula. In countries like Haiti and Cambodia, where poverty and lack of resources are common, breastfeeding is often the only option for mothers to feed their babies. In these cultures, mothers are encouraged to breastfeed for as long as possible to ensure the health and survival of their infants. Despite the differences in how breastfeeding is perceived and practiced across different cultures, one thing remains constant: the importance of breastfeeding for the health and well-being of both mother and baby. Breast milk is the perfect food for infants, providing all the nutrients and antibodies they need to grow and thrive. Breastfeeding has been shown to reduce the risk of infections, allergies, and chronic diseases in infants, as well as promote bonding between mother and child. In conclusion, breastfeeding is a universal practice that is deeply rooted in culture and tradition. While the way it is perceived and practiced may vary across different cultures, the benefits of breastfeeding for both mother and baby are undeniable. As we continue to learn more about the importance of breastfeeding, it is essential that we support and empower mothers around the world to breastfeed their babies in a way that is safe, healthy, and culturally appropriate.